So my name's Andrew Roberts. I'm a medical doctor. I have a degree in medicine and surgery. I also have postgraduate qualifications as a specialist in clinical haematology. I work in two places, at the Royal Melbourne Hospital, where I look after patients with blood cancers, and at the Walter and Eliza Hall Institute of Medical Research, where I do research in the laboratory trying to find better treatments for my patients. Every day we make billions and billions of blood cells of various different types, and the bone marrow is where all these cells are made. So it's a very high output factory that's producing blood cells every day. So when we get a cancer of the blood, this interferes with the function of the bone marrow, and it can't work effectively or efficiently or sufficiently to make all the blood cells that we need. So cancers of the blood, the abnormal cells will typically get into the bone marrow if they didn't start there already. They'll take up the space that the normal bone marrow cells require, and they stop production of the normal blood cells. And that's why people end up being low in blood counts, and so they are anemic or at high risk of infection because their immune system has been incapacitated by not having enough blood cells, or they're at risk of bleeding because the cells that stop us bleeding are too low. The central part of treatment for blood cancers has been with drug treatments. That's chemicals that we give either as tablets or as injections that are designed to kill the blood cancer cells. And they do that by getting inside the cell and damaging the DNA or the genetic code, leading to fatal changes within the cell that leads it to die. So the Walter and Eliza Hall Institute is one of the world's leading medical research institute. It studies a variety of diseases, but really it made its name in leading research into blood cell formation, why blood cancers formed, and more recently in how to develop new treatments for blood cancer. So the research that we do in the lab is firstly designed to identify the Achilles heel of any given blood cancer. Once we've worked out what the Achilles heel of the cancer is, what's its weakness and how we can target it, we design drugs that will go in and attack the Achilles heel and kill the cancer cell. We also check that it's going to have minimal effects on normal blood cells. And then we've got something that's ready to go into a clinical trial over at the hospital. So what has medical research achieved for people with blood cancers? Well, huge advances. Particularly in the last 10 to 15 years, I've been privileged to see the care I provide my patients improve really dramatically, directly as a result of advances from medical research. There's been a lot of other advances in blood cancer treatment through research. That's been through the development of targeted therapies, and I'll give you two examples. One is a blood cancer called non-Hodgkin lymphoma. 10 years ago, the cure rate was about 4 out of 10. These days, it's 6 out of 10 and rising. And the second example of how research has made a huge difference for some patients with blood cancers is a disease called chronic myeloid leukemia. That's a disease of young people, and previously the only curative therapy was a bone marrow transplant, and that was pretty tough treatment for people who underwent it. And if you couldn't have a bone marrow transplant, typically you passed away within about 10 years of diagnosis. These days, we rarely have to do any bone marrow transplants for this disease because of the development of a targeted treatment that's a capsule that people take once a day, and it's turned this fatal disease into something no more troublesome than high blood pressure. It's made an absolute difference to the outlook for people with this type of blood cancer, and our current research is designed to try to come up with other discoveries that will lead to new treatments that will be just as effective for the blood cancers that we don't have great treatments for now.